Good afternoon, everybody. Thank you so much for joining us today for this important webinar on reporting and messaging on suicide in the military. TAPS is honored to host this webinar as the national nonprofit military service organization providing comfort, care, and resources to all those grieving the loss of a loved one who died while serving in or in support of the armed forces. Today we're being joined by some very important webinar partners. We'll have on the line the U.S. Department of Veterans Affairs. SAMHSA will be joining us, as well as the Defense Suicide Prevention Office of the DoD. An overview, my name is Zanita Galino. I'm the Director of Professional Education at TAPS. We'll be joined by Eileen Zeller from SAMHSA. Also Kim Ruocco. She is the Chief External Relations Officer for Suicide Prevention and Postvention. We also have Dr. Keita Franklin from Defense Suicide Prevention Office with the DoD. Ms. Kacie Kelly, she's the Senior Program Manager for Mental Health Strategic Partnerships with the Department of Veterans Affairs, and Kelly Griffith, the Media Relations Manager at TAPS. We're going to start off by talking about the hashtag #BeThere campaign. We'll talk about HopeHelpHeal messaging and how it will support hashtag #BeThere. We're going to touch on the military loss survivor population, the veteran population, active duty military. We'll share a PSA and some resources, and also talk about how we can get our questions addressed. If you have questions during the presentation, please type them in the chat box over to the right of the screen. We'd like to turn some time over to Ms. Eileen Zeller.
Good morning, everyone, and thank you for joining us this morning. My name is Eileen Zeller. I am lead public health advisor in the Suicide Prevention Branch in the Substance Abuse and Mental Health Services Administration. The mission of SAMHSA, as we call ourselves, is to reduce the burden of mental illness and substance abuse on America's communities. I'm very honored to be here this morning with our partners from the VA, from DoD, from TAPS, and as well as everyone who's listening in on this morning's call. I love communities. I think that together we form a really powerful community, and I'm happy to introduce the #BeThere campaign to you. So Suicide Prevention Month is an annual occurrence, and it's a wonderful opportunity for all of us to raise public awareness about the suicide risk among veterans and service members in this country. But we do not want to stop there. Raising awareness is not action, and we want people to be able to take action, and we want people to know that hope is out there, help is out there, and healing is out there. And so one of the things that this campaign is doing is we want to ensure that veterans, service members, families, friends, VSOs, support networks, neighbors, everyone out there knows about available suicide prevention and mental health resources. That's number one. We want people to understand that hope really is available. When you're feeling alone, when you're feeling like a burden, when you're feeling like no one out there has ever been through what you're going through before, there really are people who have been through there. There really are people who want to help. And part of what we want to do in the #BeThere campaign is to show you how to connect to those people so that you can talk to people who really do understand. Another piece of it is healing. You don't have to go it alone, and there are people in your position, in the position of your spouse, of your son, of your daughter, of yourself, who have been through what you're going through and have healed. And sometimes that is, sometimes that is as a result of being with other people who can understand you, and very often it's a part of treatment. We know that treatment is available and treatment is effective, and people do recover. So part of the Be There campaign is to promote hope, help, and healing across the country for veteran service members and their families. So the Be There campaign is a campaign that that you can participate in both as an organization, as an agency. You can do hashtag Be There and then put the name of your own organization, hashtag, you know, Be There TAPS, hashtag Be There DOD, hashtag Be There, you know, Cincinnati Department of Veterans Affairs, whatever you are, and help promote this message. We want to encourage people to think about the many ways that they can help a veteran or service member who's in crisis feel alone. Feel less alone. Oh my goodness. Okay. We want to promote resources, both national and local, and we want everyone to know that there is something that they personally can do, whether that is just to connect to someone, to say, how are you doing? You're looking down. Do you have 5 minutes for a cup of coffee? And I'll listen to you. Or whether that's to give them the telephone number, for instance, for the Veterans Crisis Line, also known as the Military Crisis Line, 1-800-273-TALK, so that they can talk to someone when they're in crisis, or if they're worried about themselves, or if you're worried about someone else. I think that what we're trying to do is really inspire folks to be a part of this, and to know that there is something that they can do. And I think I'm going to stop there and just turn it over to my colleagues in the other organizations with whom we're working, so that they can give you specifics and show you how you can learn, contribute, and how you can help a veteran or service member who might be thinking about suicide.
Thank you so much, Eileen, for that valuable information. We'd like to turn time over now to Kim Ruocco, who will talk about surviving military family members and that specific population. Kim?
Thank you all for joining us today. This is so important, this topic, and we decided to pull this webinar together because as Suicide Prevention Month comes upon us, many people will be talking about suicide. As a survivor myself, one of the things that was really important to me was to use my husband's death to make some changes. His death seemed like it was such a useless type of death that I wanted to make sure that there was something that I could do with it that was worthwhile, that maybe could save some lives. So one thing that we often don't know for reporters and others who are doing stories about suicide is that for family members, it is often really helpful for them to talk about the death, and that using their loved one's loss to make a difference is an important part of their healing. So family members are usually very open to talking about the death of their loved one, and many of them will be more than willing to contribute to stories in various venues. Next slide, please. So there's a few things that we need to kind of remember with messages for survivors talking about their loss and using their loss for prevention purposes. The first one is that many times a death by suicide leaves family members with a puzzle that's sort of been thrown on the ground with many pieces scattered all over the ground. And that survivors spend a lot of their first years after a death trying to put together those pieces of the puzzle to kind of understand how their loved one could end up dying in this manner. And what they find over time, hopefully, is that suicide is a multiple factor event that often happens on a perfect storm day. That it's not one thing that makes somebody die by suicide, that there's many factors that build up over time. The second one is that often there is a mental illness that is contributing to the death, and it may be either not treated or not treatment that's working at the time, but that mental illness is treatable, especially if we treat it early on when they're first having signs of problems. And also to remember that people who die by suicide are maybe not even wanting to necessarily die, but they're wanting to end pain. So as survivors are kind of putting together their stories, they want to kind of think of those themes and integrate them into their story. And it's helpful if you can support a survivor in thinking about those things. Other key messages are that suicide is not a selfish act. We hear this so often as survivors. This is one of the most hurtful things that we can hear, like how could your loved one do this to you? They're so selfish. It was a selfish thing to do. And what we know about suicide is those that die by suicide are often in a state of mind that they feel that their life, their problems, their illnesses, their injuries have become so overwhelming are now a burden to others in their family, and they may have a misguided view through clouded thinking that they are now a burden to others. Another thing for survivors to think about and to remind survivors whenever they are putting together their story is that the information that they have now is on the look back. That many of the things that you're talking about now, that you're including in your story, is not something that you understood or you knew at the time. That you cannot prevent what you cannot predict, and that we never would have predicted that our loved one would die by suicide, so therefore had difficulty preventing it. It's important for families, too, before they talk about their story, to really educate themselves on risk factors, protective factors, and resources, and include those in the story so that people can find some help as they are reading the story or after they read it. Next slide, please. So, to share the story of suicide loss, it is important to have a purpose for it, that it's either to provide hope, healing, or prevention. And that the story is really important to think of some things before you write it, because what I didn't really understand when I first started talking about my story is that there are safe ways to talk about suicide, and there are some not so safe ways to talk about it. We encourage all survivors who are telling their story to think about safe messaging guidelines, which we will have attached here at the end, and try to incorporate safe messaging when you are talking about the death. Next slide, please. One of the most important things about safe messaging is that, that we need to focus on hope and resources. Some of the examples I might share with you today is the campaign around 22 suicides a day in the veteran population. While we admire people who are raising this awareness, and this was an important topic to raise awareness about, sometimes using just the numbers over and over again can breed helplessness and hopelessness in those that are suffering. A good example is this, is we've had several veterans who have left suicide notes after their death, and family members have shared them with our TAPS staff. And these suicide notes share that, they became hopeless when they saw that 22 of their peers had died by suicide. So when we are doing push-up challenges and other awareness events, please keep in mind that it's okay to do the 22 push-ups, but please include messages of hope, messages of healing, and resources for people to connect to. Or even better, change the campaign to 30 push-ups for the 30 veterans who are saved on the National Crisis Line every day from attempting suicide. Next slide, please. You also want to remember that all the information that is used in stories are information gathered on the look back, and that this information that survivors are sharing is information they've gathered after a couple years of talking to people, learning, reading, understanding, and talking to other people who knew little bits of information, and that this is not something that they knew at the time. And also to remember that while their loved one life is something to be glorified, to be honored, that the way they died should never be glorified or held up as something that is is an honorable thing to do. So focusing on the life lived, focusing on hope and healing and the resources will go a long way in being able to use survivors' stories for hope and to have a real impact on prevention. Next slide, please. Also, remember to always include that treatment works, that suicide is complicated, and that most of those people who die by suicide have less likely to have been in treatment. Use the word died by suicide instead of committed, and remember suicide is an illness. It's not a sin or a selfish act. Okay, well thank you. So we will now go on to our next presenter.
Thank you so much, Kim. We're going to now turn some time over to Dr. Keita Franklin, and she's going to speak to the active duty population.
Hello, and thank you so much for having me this afternoon. I'm so pleased to be here with our other federal partners and with the TAPS organization as a whole, and appreciate the opportunity to talk about the active duty population and how this population fits into the broader conversation about suicide. When I think about suicide in the media and messaging, oftentimes I overly see instances where the media focuses on active duty suicide in the context of deployment and overly emphasizes active duty characteristics as reasons for suicide. And what we know is that the active duty lifestyle is certainly a stressful one, but it's also there are also a lot of strengths attached to being in today's military, and that these are not always risks for suicide. And so our population does fit in or is nested into the larger, broader population, and suicide is certainly a national problem, not necessarily a military-specific problem. And we like to think of it as a public health problem that calls for multi-strategies to prevent it. And proper messaging and safe messaging is one of many strategies that we're trying to get after in the Department of Defense. So we know from some of our other speakers this morning that suicide is a complex issue. When somebody dies by suicide, they never die due to one reason. It's never that simple. And I think that's probably the best reason why a public health approach or a multi-pronged approach with multiple strategies is best suited for this type of public health problem. Talking to the media and messaging about suicide is complex. Oftentimes we'll think through these conversations in the context of how hard it can be to talk to the media, in part because we're not wanting to tell the media how to report, necessarily we're always trying to be transparent with what we share, and we're not trying to hide things. So within the department, you would see on the dspo.mil website, where we're always posting our quarterly data. We want folks to know where we're at with the prevalence rates and what's going on with the problem in the DoD, what we're trying to do about it. But at the same time, we're also not wanting it overly glamorized, or we're not wanting inappropriate images or pictures of service members displayed in distress, or negatively slanted articles that are geared toward for example, deployment being the reason someone died by suicide. As we know that's just not the case. The research doesn't bear that out, and nor is it ever one issue. So these are tough conversations. Recently we brought together a number of our partners, some of whom are on this webinar today, alongside the national broadcasting industry and the National Action Alliance, to talk with the media just about how difficult this is. And I'm very pleased that we have adopted these safe messaging strategies, and we're continuing to have dialogues with the media on their role in preventing suicide. I mean, when we left this roundtable discussion, I thought it was very clear this month that the media has an active and important role in the prevention of suicide, right alongside all of our other gatekeepers like mental health community, practitioners, chaplains, community-based support helping professionals. All of us together can truly make a difference and are all necessary. I couldn't be more pleased about the Be There campaign this year, and the fact that the other federal partners and TAPS and our other nonprofit entities are pushing out this campaign, in part because the active duty military is a population that's already predisposed for being there for one another. They have a tendency to work together already, to push out peer-to-peer help and interventions. When one airman's helping another airman, we know we have it right. We know that that things are going well when they go to one another for help. And so we can go to the next slide. I did want to share a little bit about social media in today's webinar. The Department of Defense has recently sponsored a study. We've gotten the study results have bared some interesting information that I believe no one has researched or studied yet, and that is that today's young people, particularly at the active duty forces, have been posting suicide risk factors, many that you heard about from my colleague Kim Ruocco this morning. Many of these risk factors are posted online in open domain social media forums, whether it's Facebook or other types of social media. And they're posted in such a way that service members are listing that they've had a negative event, perhaps a relationship breakup, a marital dissolution, some sort of problem within their workspace or their unit. And they're often, it's listed perhaps in what we call coded language, so you may not exactly know what's going on, but you'll know that something is not well. And what we found in the research is that all the traditional risk factors that are out there for suicide are posted on social media. And negative thoughts, negative emotions, and inability to cope or problem solve around an issue, to include pictures of alcohol around the same time frame and or pictures of weapons. So we see this as a very unique opportunity for intervention, and there's more to be studied about this issue. This is just the first of many, of a lot of research that probably has to occur on social media and how it impacts today's young people as it applies to communicating about risks, either through individual posts or through posting on others' posts, if you will. And so we ask for folks that see those type of risks on social media to do something, to make a call, to connect the person to the crisis line, to the lifeline, to offer your own support and help, to ask if they are okay, and to take it a step further if you need to and ask the question as to whether they're thinking of ending their life, and also just to be there, just as the campaign says. And so I believe that's my last slide. Again, I'm happy to be here, and I thank the TAPS organization for your leadership on this issue.
Thank you, Dr. Franklin, for that wonderful contribution. We're now going to turn some time over to Ms. Kacie Kelly from the U.S. Department of Veterans Affairs, and she's going to speak to us specifically around messaging and how it relates to our veteran population, those that are most vulnerable. Kacie?
Hi, good afternoon, everyone. My name is Kacie Kelly. Thank you for having me on this webinar today. I'm honored to be here and look forward to continued work with this group. So just a couple of things that I wanted to highlight related to recently released data report that VA released, which is the largest analysis of veteran suicide that has been completed to date. We are really looking at the veteran population as being part of a larger public health issue when it comes to suicide. Suicide, unfortunately, is increasing in the American public, and veterans are one piece of that. But what we know based on this the recently released report is that many of the veterans who are dying by suicide actually are not touching our system and are not engaged in mental health care. And so we're really working to elevate suicide prevention efforts outside of mental health and to really look at it and address it from a larger healthcare system view. And within that, we know that veterans who are most vulnerable largely include those who are not engaged in our healthcare system at all. While we are currently treating approximately 40% of veterans, 60% of veterans get their healthcare somewhere else. And so we are working to identify strategies for engaging those veterans who are not engaged or not participating in VHA care. In addition to that, veterans who are over the age of 50 are more vulnerable, as well as our women veterans. The suicide rates among that population is increasing. In addition, the report identified that the periods of life when veterans are transitioning, whether that's from active duty to veteran status or experiencing other transitions, might be time periods when veterans might be more vulnerable. Okay, next slide, please. Thank you. And we are thrilled about the Be There campaign. We are talking about suicide prevention being everyone's business and looking at sort of a much more multifaceted intervention. And the Be There campaign is perfectly aligned with that. We want to emphasize that everyday connections make a big difference to someone in crisis or someone who may be struggling and having thoughts of suicide. What is really great about the Be There campaign is that you don't need special training. Anyone can safely talk about suicide risk in a candid and genuine way to show that you care, and it really emphasizes the power of one connection and everyone being able to make a difference when someone is in crisis. We are encouraging people to act in many ways, whether that's picking up the phone and calling or reconnecting with someone on social media, going for an exercise, or meeting for coffee. Anyone can be there for veterans or service members. And then also the campaign provides an opportunity to educate our peers, veterans, service members, as well as other people about suicide prevention and the available mental health resources that exist either through VA or through SAMHSA or DISPO or our friends at TAPS. And then finally, to inspire communities to take action and to be there for veterans and service members in their networks and local areas. We can talk all we want about it at the national level, but really where the rubber meets the road is out in the communities, in those local connections and areas. Okay, I think that's it for me, and I'll look forward to answering any questions that are available later in the webinar.
Thank you so much, Kacie. We really appreciate your input, and it's valuable. We'd like to turn some time over now to Kelly Griffith.
Hi, everyone. So there are many resources to support sharing the message of suicide in the military. Please visit the National Action Alliance for Messaging Framework. For additional information, you can visit the Defense Suicide Prevention Office at dspo.mil, the Substance Abuse and Mental Health Services Administration at SAMHSA.gov, and the Suicide Prevention Resource Center at sprc.org. The VA crisis line is available to our military and veteran populations at 1-800-273-TALK. That's 8255, and press 1. And as always, if you are a survivor of military loss and need support, please call TAPS at 1-800-959-TAPS, 8277.
We'd like to ask at this time that if you're not muted, to please do so we don't have feedback for the next session. So please mute yourself if you have not already done so.
And we would now like to launch a public service announcement for the hashtag HopeHelpHeal messaging.
My mother was an airman.
My friend was a Marine.
My son was a soldier.
He died by suicide.
On March 21st, on April 25th,
August
2011.
7th, 2004.
She didn't think there was hope.
He didn't think there was help.
He didn't think he could be healed.
There is hope for your son.
For your friend.
For your husband.
Treatment can work.
There is hope.
There is help.
You can heal.
Okay, so thank you so much to all those who joined. We do have a question that has come in, and it is, during my 24 years in the Air Force, suicide prevention training seemed to put the burden on the individual to see, report, and follow up as a wingman. Post-military, I took assist training, which I found more effective. To 1, directly ask someone who exhibited signs if they were considering suicide, and then 2, quickly refer to a trained call center or mental health professional. Any movements in DRD or VA to follow this model?
Hi, this is Dr. Keita Franklin. I'm happy to answer that question. It's a good one, perfect timing actually. We are in a number of meetings with the assist folks, and we are in the process of evaluating that curriculum. The Army has adopted it, I know, and many of the services are looking into it. It's definitely an evidence-based approach, and it has a lot of science behind it, and so we are looking into that. I would say that it's probably not one without the other. I agree that historically I think we've had a problem in the department where we've overly focused on, as you describe, scanning the units, identifying who's at risk, and getting them into care, instead of thinking about the importance of peers and thinking about chaplains and thinking about the broader community of helpers. So I think it's probably all hands, everybody, by sort of an overly focus on 1 or 2 capabilities. We should think more broadly and understand that today's service members are, when they're willing to go to help, when they're willing to get care and go in for help, wherever they go, they should get the help they need. And so certainly we need to make sure that everybody's trained at their appropriate level and good to go to do something. And if the needs are high-end and the answer is mental health care, then we certainly need to take swift action. Hopefully that answers your question.
Thank you, Dr. Franklin, and thank you for that wonderful question, Chris Ford. Kim Ruocco, do you have anything that you would like to present on your end before we close out comments on the survivor population?
No, just that everybody, this is an opportunity for all of our surviving families to really get on board with this campaign. I know that they are there for each other. We see it every day in our peer support network, but it's an opportunity to be there for everyone around you and to notice whenever they're struggling, and connect them with hope and connect them with help and get them moving towards healing.
Thank you, Kim. Eileen, would you like to present anything on behalf of SAMHSA before we close out our meeting?
Sorry, I was muted. If you remember nothing else, please remember the Lifeline Military Crisis Line, Veterans Crisis Line number, 1-800-273-TALK. Thank you for everything that you do, everyone on the phone.
Thank you so much, Eileen. And Kacie, we'd like to see if there's anything you would like to add before we close out on our presenters' comments.
Thank you. Yeah, no, I don't have anything to add other than to thank everyone for being on this call, and thank TAPS for pulling it together and coordinating and organizing it.
Okay. All right. Thank you so much to everybody that took the time. This webinar has been recorded, and we'll make it available. We are also going to send out a link to that PSA so you can have it in good quality, in a good shareable way. Oh wait, we have some more questions coming in. We said, how can TAPS help get our message out and get us working closer with you? And also, how can reporters get the local VA with stories on this? So we have on the screen now, all those can be addressed by emailing us at media@taps.org. We're grateful to put you in touch with our community partners. We're definitely stronger together. So send all your questions and comments about this webinar to media@taps.org, and know that TAPS remains here for you. Have a wonderful day, and thank you again for joining us.